It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Dr. Annie Varughese and welcome back with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that help change people's lives. We have a great show for you today. Let's learn more about our first doctor, Dr. Gabriel Maislos.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda is a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
Told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight, and the clamp on the nerve are the protective covering, which we call the flexor retinaculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is, research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart, that is the valves and the great vessels, and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today, and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
Quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our original objective of research and education. But at the same time, we've made many advances in just clinical medicine and surgery, and have enjoyed a leadership position in this new development now. It's sort of inspired the entire medical community around the world. And you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
We are the Babetta Lindick breast center at the Hermann Memorial City Medical Center, and we provide all these psychosocial services to our patients newly diagnosed with cancer to assist them through their journey.
It's a very, very special place, and it's a special place in part because we were fortunate to have a benefactor to provide us the state-of-the-art facility with the state-of-the-art equipment. But it's much more than that.
Well, in terms of for our patients who are coming in through our breast center, coming in for their screening, sometimes coming in for diagnostic imaging if they have a breast lump, following through the process, having a biopsy, they come in feeling well, feeling good, and then all of a sudden they hear those three words, "You have cancer." That can be very scary, particularly when they were not expecting this. So this is through our breast center, we have a complimentary service. We have a breast oncology nurse navigator just to meet with you, to visit with you, to be with you where you're at, to educate you, to empower you with questions.
A patient comes in and they're diagnosed with breast cancer. That's a big shock because most of our patients are very healthy. They don't feel sick. And so to get this diagnosis, it's a big trauma. Having someone who can navigate someone through this shock to get them through this in a very healthy way. And the reassurance that at the end of the day, most of them are going to do very well and they're either going to be cured or they're going to have a very good result.
So when patients coming in with a new diagnosis of cancer, we are there to offer these comprehensive psychosocial services to assist them through this process and journey.
This center sees more breast cancer than any other hospital in the city of Houston, including MD Anderson. So it's a little known fact, but we have something to be very proud of, and both the ability to give the patients the state-of-the-art care as well as to handle a large number of patients I think in a very caring way.
Many patients complain of leg pain from vein problems. Veins can dilate, they can become aesthetically unpleasing, but they can also cause vascular abnormalities which can lead to clot formation. Dr. Peter Morgan is a vein specialist, and let's look at this segment how he has helped one patient about a vein problem.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, you know, exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
There are certain symptoms we have as human beings that can alert us to diseases that can be a problem. This may be very early in the disease process, so it'd be good to catch it at that time. For example, unexplained weight loss. That's a real danger sign. Weight should not just peel off for no reason. If it does, you need some tests to find out why. Night sweats, that's a real important symptom. Now this isn't just where you get hot because it's a hot night out or you have too many covers on. This is when you just get drenched at night on a regular basis, say more than 10 or 12 nights a month. If that's happening, that is really a sign that there may be diseases going on, all kinds of diseases. You need to get a checkup for that. Headaches that wake you up in the middle of the night, those are bad. You should not be awakened by a headache. Also, a severe headache, a severe and sudden headache, or a change in the pattern of the headache that you usually get, that's another danger signal. Change in your bowel habits, bleeding in your urine, blood in your stools, those are problematic symptoms. Also, if you have a cough that won't go away, now a cough that's just with allergies, that's one thing. But if you have a cough that goes on and on and on, let's say over 4 weeks, you probably need to have that checked, especially if you're a smoker. Now, the main thing though is to think about unexplained weight loss, night sweats that are more than just a little warm and a little hot, and just any symptom that seems to be out of the ordinary, an abdominal pain that you didn't used to have, a headache that's changed its nature. Check on those things and ask your doctor if there's any question.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
For more information on any of the doctors you've seen on today's show, go to our website, bestdocsnetwork.com. Now it's time for me to share a story with you. My passion is the prevention and treatment of cardiovascular disease. I've practiced 20 years, touching people's lives, saving their lives, ministering to their lives. Let's watch this story about one patient who came to my practice and how we helped that person.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, "It looks like you had a couple small strokes. They're small, they're not going to bother you. But," he says, "you need to go to a cardiologist to check out your heart, just to be on the safe side."
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound, and she says, "Could you see the mitral valve there?" I said, "No, I'm not trained for that." She points with it to her pen and says, "Right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything." And so she says, "Within a month, you're going to have a massive heart failure." And I heard my wife gasp, and I got rocked. Wait a minute, I feel fine. She said, "I'm checking you into the hospital right now."
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varughese hadn't caught that ruined mitral valve, and so I owe her.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Atrial fibrillation, a commonly known arrhythmia that involves the upper chambers of the heart becoming irregular and beating sometimes wildly out of control, sometimes beating very slow and causing the need for a permanent pacemaker. Atrial fibrillation is another risk for stroke, and therefore patients who have atrial fibrillation really need to see their doctors, be evaluated, and get on anticoagulant therapy just to protect them from stroke. Now, what causes atrial fibrillation? That's a question that many of my patients ask. Doc, why am I having this problem? And I say, well, the electricity of the heart can change over time. Sometimes as we age, our cardiac cells can change their electrical impulses, and things can kind of go haywire. So we want to make sure that we look at an EKG each time the patient comes in. It's important to check those things and ask your doctor to do an EKG if you haven't had one. If you have palpitations, if you have shortness of breath, feeling faint, make sure you have your rhythm evaluated with an event monitor or some type of Holter monitor. It's very important. Atrial fibrillation is something easily treated. Protect yourself. Get your heart checked today. Our smile is such an important part of our lives. Keeping a healthy smile is also important. Dr. Paul Metz is an oral surgeon who helps patients to keep their healthy smile. Let's watch this story about a patient and how he helped them.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth. And George is a very outgoing person and likes to smile and has a great smile. And so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Osteoporosis is a disease. It's a disease of bones. It manifests as either a fracture or the realization that the bones are very, very thin with a high risk of fracture. It's important. It's common. It happens in over 50% of women postmenopausal. That's to say, over half of women over the age of 50 are going to have a fracture in their lifetime. And it's serious because some people that have hip fractures will die very quickly. Some people will go into a nursing home and not get out. Since it's a function of time and duration of estrogen deficiency, the time since estrogen deficiency with the thinning of the bone is predictable. It may be needed sooner if there are other risk factors for thinning of the bone sooner. Smoking, extreme thinness, sedentary lifestyle, parents' history, or a previous low trauma fracture. Most objective way to quantitate the status of the bone health, thickness or thinness, is to measure the areas of interest of the spine and the hip, since those carry the most risk of morbidity and mortality. It's done on an X-ray type device called a bone density unit. It's painless, it's easy, it's safe, involves lying on a table and being positioned as you're able. It's not exactly the same as doing x-rays for fractures, although it may be more sensitive for certain kinds of painless fractures. It's not for diagnosis of various diseases or fractures in general. The ultimate goal of screening is to prevent death and disability from fractures. We're trying to predict fractures based on age and the thickness of the bone. If someone has very thin bone, then they have a very high risk for fracture. We recommend that all women have bone density testing at age 65 and sooner if they have risk factors that would indicate that they would have high or increased risk for fracture.
On a day-to-day basis, I was experiencing chronic pain, a chronic migraine all day, 24/7. I'd wake up with one, I'd go to bed with one, and it would never go away. I tried everything from acupuncture, a chiropractor, nerve blocks, spinal tap, and there was no relief with anything.
When Jennifer first came in, she was 17 years old, had been totally debilitated by her headaches, had been basically housebound, was homeschooled, hadn't been able to do all the normal stuff the teenage girls do during high school, just because of her chronic daily pain. And so we talked, decided she was a good candidate for the trial, and then when we did the trial, when she came back several days later, she'd been almost essentially pain-free from the time we put the trial in to when she came in to take the trial out.
The 5 years I experienced chronic daily migraines, I was completely limited. I couldn't do anything, stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so, and Dr. Reed decided one day to somebody with headaches to try putting a stimulator over the peripheral nerves that supply around that scalp, and the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80–90% relief, that was real dramatic, and that was, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
What a fabulous show we had today. I hope this helped you to discover some things that you need to do to protect yourself and your family. The Best Docs Network features some of the best physicians in the Houston area that have helped change people's lives. For more information for any of the fine doctors that you've seen today on today's show, head to our website at bestdocsnetwork.com. If you have a question or a comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. See you next time.